Hi, it's Beck here from Sunbury Local Businesses, and today I'm here with Chris from TerryWhite Chemmart in Sunbury. How are you, Chris?
Okay, good, thanks.
That's good. I wanted to talk to you about hay fever.
Sure.
What is it?
All right, so hay fever is a collection of symptoms that is really just the body reacting to pollens and dust and whatnot that are in the air this time of year.
Yeah.
Yeah, so...
And so what are symptoms that people would experience?
Yep, so commonly runny nose, itching, sneezing, sore or itchy nose, throat, that sort of thing.
Yeah.
Possible headaches sometimes.
Okay.
Yeah, just general fatigue, feeling of fatigue.
Oh, awful. I have heard a stat that there's 1 in 5 Australians.
Yeah, that's right. It's pretty common, very prevalent through the community. As I said, 1 in 5 would be a pretty telling stat.
All right, and so what are, I suppose, the differences between a common cold and hay fever?
Yep. Okay, so with the common cold, it can happen throughout the year, not just in response to pollens and whatnot. Probably the main symptom that'll be different will be itchiness.
Okay.
Itchiness throughout the throat, the skin, that sort of thing. Cold is really just confined to mainly the nasal passages and the head.
Right, okay. And so for people with hay fever, what are some precautions that they can take to avoid triggers?
Yes, probably the easiest thing is to avoid pollen. So on the high pollen days, check the pollen counts. I think melbournepollencount.com gives you a daily reading. If you can avoid being outside on those days, maybe avoid drying washing on those days as well. And if you can, when you're planting a garden, maybe choose plants that have low pollen emitters.
Yeah, okay. And then what about things like there are tablets and there are nasal sprays and things like that?
Yep. So you've got a lot of options. So tablets are probably the mainstay. You've also got nasal sprays, which contain like steroids and whatnot to settle down the reaction in the nose and throughout the body. There is eye drops for mainly people who get those really bad eye symptoms. Yeah, the other thing you can do for prevention is probably consider taking specific vitamins, which will dry the nasal passages and some of those symptoms up as well.
Okay, perfect. And then there's also been a lot in the media about thunderstorm asthma. Are the two related?
Well, not strictly. Basically the thunderstorm asthma is a reaction that can happen when there's certain pollens in the air, when big storms come through. And yeah, basically an allergic reaction can trigger asthma. And people who have really bad hay fever, when they get that cough and wheeze, they're probably most at risk of potentially getting the asthma symptoms. Right,
okay. All right, and who would be at risk of thunderstorm asthma?
Yeah, not only asthmatics, but people who get really bad hay fever, so especially where you get the associated cough and wheeze. Yeah.
Okay. Well, look, thank you so much for running me through all of those things today, and hopefully everyone can come on down and get themselves some relief.
Hopefully.